Good morning, Grenada. You're listening to Hard Talk Grenada. A special good morning to those of you joining us on 97.5 City Sound FM, 89.5 CRFM, 92.9 Sister Isle Radio broadcasting from Hillsborough, Carriacou, and of course 94.9 We Noise Radio out there in Brooklyn, New York. A special good morning to those of you joining us on the live videos, whether it's on Facebook or on YouTube. A special good morning to you. Remember to like the live, share the live, call somebody. Let them know that we're having a really good discussion this morning and they should listen. They should be a part of and contribute. This is your opportunity to ask all of your questions, of course, as we mentioned yesterday, as respectfully as possible. Don't give me a reason to have to cut anybody off. We are trying to be as respectful as possible. So you will get an opportunity to answer or to ask your questions and have them answered at some point during the morning. But with me in studio this morning, I have two very handsome gentlemen, Mr. or Dr. I should say, Francis Martin, and of course, Mr. Keville Frederick. Good morning, gentlemen. Good morning. How are you?
Good morning. I'm well, thank you.
Great, thanks.
Wonderful. Well, we all know why you're here. Of course, this is a burning issue for a lot of us as Grenadians, and not just Grenadians, but I think the world on a whole is really at the edge of their seats. We're really uneasy once again as it relates to this epidemic that is the coronavirus. We've gone through the rains. We've had the Ebola. We've had the H1N1. We've gone through it. I mean, this procedure, this process, this feeling of fear is not new to us, you know. But I think that with information, it really does ease the mind of a lot of people, you know. And I'm hoping that people listening are open to the information that they receive, because sometimes we ask for information and when we get it, we still didn't want to receive it the way that it's given.
Oh yeah.
You know, but I'm hoping that, you know, people are open to receive the information that they are getting. So let's just get right into it, because I know the burning question on everybody's minds is, what are we doing, and are we really prepared for an incident of this coronavirus?
What are we doing? Well, I always like to start from the beginning.
Yes.
And just to indicate and sort of confirm that you said that the world is now again on its feet, because for yet another time in our history, a virus had mutated enough to be able to jump from animal to humans,
Right.
and not just animals to humans, but are actually being transmitted in between humans. And as you said, we've been there before and we came through it and so on. And because it is a new virus, there are no treatment for it, there are no vaccines for it. But the good thing about this particular virus is that the mode of transmission is in itself a way to protect ourselves, and that
Right.
is it is transmitted through droplets, touching, wiping out. It's just as how the cold is transferred from one person to
Right.
the next. Is the same thing, the coronavirus, and hence the reason what we're doing exactly what we would do if someone had a cold.
Right.
That is, we're saying to people, first and foremost, and we need to reinforce that during the program, you must practice good cough etiquette and hand hygiene. Wash your hands for 20 seconds, cough into your elbows, stay within social distance of another person and not go into their personal space, because if they're coughing, then you can transmit the virus through droplets and that sort of things.
Right.
And so that is the most important thing, getting the information out there. But let's deal with the fears of the people. People worried about trans-border crossing, the virus moving from one part of the world to the next, and people are supposed to be concerned about that because that's the public health risk.
Right.
So first, we look to see what our World Health Organization and our regional partners are saying regarding to the risk levels and what needs to be done. So we're in constant contact. The Ministry of Health is in constant sort of daily contact with the or Pan-American Health Organizations or Caribbean Public Health Agency, which gives us the overall science of it, the updates and the guidelines as to what countries' response is supposed to be.
Right.
At the moment, the response says that we should do heavy surveillance at our ports because we think that it's going to come in at a port. So at our health facility at the international airport, we've ensured that we've been there with our nurses, we share the guidelines with them, we
Right.
train them, we continue to reinforce what we've always been doing anyway, just a matter of reinforcing it. Mr. Frederick will speak about our thermal cameras that was installed and the kind of process that we need to go through in
Right.
if anyone has any suspected symptoms. We've also put together our screening area and our holding area for quarantine if there needs to be quarantine. Or isolation, so to speak, of any person if should any one of them have fever or show any signs. So those we have in place.
Right.
Further to that, we are in constant communications with the administration of the airport to be able to send up the passenger flight list.
Okay.
And the list of flights that are coming into the country, when they're coming and what time they're coming, so that we mount an adequate response at our port at the airport.
Okay.
Within our health facilities itself at the hospital, we've made arrangements to have quarantine areas. We've made arrangements to have isolation areas, and the arrangement were not just for one isolation if needs be, but we've also made arrangement if there is a need for mass isolation.
Right.
Let's say there is a whole plane load or something like that you need to put into isolation. So those discussion has been ongoing. As the virus evolve around the world and as we see what it is doing, we'll be able to mount response as needs be.
All right, wonderful. Now, I know the question on everybody's mind is that enough? You know, is it in collaboration with, or is it in sync with what other countries around the world is doing? Is it up to standard? Is what Grenada doing up to the standard of what is expected internationally?
Well, that is relative, but countries' response would be dependent on so many other things. Countries' response will depend on the economy, depends on their size, it depends on the kind of relationship that they have with. And so countries have a right to respond as they want to respond. For small island developing states and for developing countries like Grenada, our response cannot be the same as that of Britain.
Of course.
But what we do, we rely on the science, and not just on the science, we rely on our public health agency in the Caribbean, Pan American Health Organization and World Health Organization, who constantly updates us as to what small island developing states needs to do. So whatever response we're going to give, it will be in line with what is recommended for small island states like
Right.
ours.
Now, Mr. Frederick, I want to move to you because I want to hear more about these thermal cameras, because I think a lot of people don't understand really what it's about. They think it's just a camera, somebody pass in front of it and it tells you if the person has a virus or not. So can you explain to us a little bit more about what this technology entails?
Okay, before I do that, let me just echo two important points that Dr. Martin raised. And I'll start with the latter first, when he made mention of, are we doing enough? We are guided by risk communication strategies. As he said, right, it depends on what needs to be done.
Right.
Now, so as we sit here rather, this is our risk communications handbook. That's the guidelines.
Right.
As you would, if you look carefully, we were at level green. That's when we had low risk, very, very low, nothing happening. It's like on the traffic light, all clear, you can drive.
Right.
Now we have since moved to guarded, which is blue.
Right.
Now, and this has been shared with our CAFA network. CAFA had input in it. Dr. June Murray from Pan American Health Organization, who is an expert, who was down here when we did our IHR review and spearheaded that mission. He also had input in this. Now, if we need to move to a higher level, we will.
Right.
So we are guided. However, as Dr. Martin was saying, people must understand that green Grenada and other countries in the region, right, tops the prostate cancer rates in the world. But we have small populations. Why? Because it is per every 100,000 capita.
Right.
So it may sound funny. Well, Grenada has just under 110,000 people. The US has millions. China has millions. But yet we are on top. So people must understand the dynamics and profiling of how those things happen. So it's not just that, are we doing enough? We are doing what we ought to do in a systematic fashion. We cannot just jump and do it.
Right.
Now, to answer the question on the thermal cameras, the cameras were installed a couple of years ago, right? We kept monitoring, maintaining. It is good working cameras. As a matter of fact, when the camera was installed, it was just after we came out of Chick-fil-A.
Right.
And we moved to Zika, so it was there during Zika, right? Now, recently what we did is that we repositioned the camera for better capture. And I am one of the persons who installed, commission and maintain the camera. So I could actually tell you how it works firsthand. Now, when you enter into the arrival area, you will make a right turn. The camera captures you from there. You're not really going to notice what is happening because it's an automatic system.
Right.
However, the camera can scan you from this side. It doesn't mean that you have to be facing
Facing it.
head on. It will pick you up from this side when you make that first turn. And when you're coming up, it captures you direct, dead on target. So your forehead is in the camera. So that way you're walking towards the camera.
Yeah.
It captures you there likewise. Now, based on the clinical case definitions and so forth, you will then adjust the temperature readings that you're looking for. So let's say, for example, I think it was in Zika, we were looking for something about 35, 36 thereabouts.
Right.
So we set it at that, right? So that's what we are looking for. Sometimes what we do is that we may even set it just lower. So once you come in and your temperature hits that mark or it goes above that mark, you will not know, but the nurses will know because the system will alarm. It is going to alarm very loud, but you, the passenger, will not know.
Right.
You may just see one of our nurses come out and ask you to come out of the line, and you might be wondering why.
Right.
But on the back end, that's where everything takes place.
Right.
So, and I read on Facebook, if it is just a facial recognition camera, there are certain things we would not speak about for safety purposes because you have security and safety as well. It's an airport we are dealing with.
Right.
But rest assured that once the camera records your temperature, it dumps your photograph down on the bottom pane.
Right.
The camera can hold up the device rather, and system can one device can accommodate up to about 4 to 6 cameras.
Right.
We have 2 cameras at the airport. One closer to the main entrance, that's the doorway, and the other will be positioned up at closer to the kiosk area. So it captures a wider span.
Right.
Now, we also can sit in the ministry and monitor that. It's science and technology now we are dealing with. Dr. Martin can sit in his office and see everything that is going on with that camera. We can review it because, and it does not depend solely on internet, right? Because it will record everything and dump it there for you.
Right.
So a nurse or any one of us with the clearance and the access can then go in and review everything. It makes it even easier now for contact tracing because people were talking about when they leave the airport, what happens.
Yeah.
So, my friend, you cannot really beat the system
Right.
because it will record your face, and we have that, so we could track you. There's something called likewise the JRCC. We work closely with them. It's a CARICOM crime and security unit like. The JRCC, how they work? Now, we have electronic passports, right? Once you book a flight right now, you must give your passport number.
Of course.
So we know where that is going to be originating from.
Right.
When you go into the transit and everything you are going to be scanned again. Everything coming through.
Right.
I will give you an example. The Zika outbreak, Dr. Mitchell was CMO. Dr. Martin was SMO. We got some information from, he was at the time Superintendent Prince in charge of the immigration. And we got information from the JRCC. That's quite up. So we're talking about they are in Barbados, right? We knew that an African national was sitting in Florida, coming to Grenada. We knew what time, right? The seat number.
Right.
And we also knew where the flight originated from and what flight they are coming in on.
Wow.
We were at the airport awaiting the passenger. And that is serious. Ask Dr. Mitchell anytime. So the people who are doubting the capabilities, we understand why, and it's because they do not know. But like I said, we cannot speak about every security feature or measure that is at the airport. It's a highly secured facility.
Understood.
But rest assured that we have a system. As a matter of fact, I could tell you that when we got our systems, Trinidad had asked about our systems, and Dr. Michelle will share that information with you, because we were the first in the entire region to have that type of system.
Wow.
So people will talk and make all kind of statements, but they don't understand what is going on.
Of course. I always say information is power, but of course, we also have to understand that there's something called security, and there's something called confidentiality.
And information management.
Everything can be shared.
Exactly.
But sometimes I believe that as Grenadians, we don't trust our own system. And that is a very dangerous thing for a people, to not trust the system that governs you, or to not trust the system that you're a part of. And we understand that people are skeptical and afraid and concerned, and as they should be, in right. But with all of the fear and with all of the concern, we must still be cautious in terms of the information, not only that we receive, but the information that we share. It's okay to receive information. It's okay to do our research and to share what we've and to read what we've discovered. But it's what we share. Yesterday I put up a post that says that not all information or not all news sources are credible, especially when you're dealing with something that is so international. We can say, okay, well, we sit here and we take information from GBN and MTV and now Grenada and so on. However, when we go on the worldwide internet, you don't know who's sitting behind a computer writing a story. So you may read a story, it may sound good, but the information in it may not be factual. I want to read to you a post that somebody made, and Dr. Martin or Mr. Frederick, I'm hoping that somebody can comment on it, because I thought it carried a lot of weight, and it kind of coincides with something that you would have said. It says, I don't want to read the first part. I'll read the second part that says, furthermore, what news sources can or do you trust? Consider these facts. What's the population of China or Wuhan? The number of people infected per city, the nature of the virus, precautionary measures, recovery rate, age group of the persons who have died, the risk associated with flying our students from Wuhan city when the city is in quarantine, and the risk, let me pull the whole one, sorry. And the risk, and the risk associated with them, and for the arrival in Grenada. And I liked this simply because it speaks a lot to what I'm thinking. There are a lot of factors to take into consideration. We have over 4,500 people worldwide, maybe more by now, that have been infected, yet only 130 people have died as a result. So that leads me to think, what exactly caused the death of these people? What were their age? What were they exposed to? What were their health conditions? All of these things that need to be taken into consideration. It's just the same as somebody who would have contracted, and I know a lot of people don't want to hear this because they don't associate it with the coronavirus, but it's similar with influenza. Somebody with a respiratory illness, a long-term respiratory illness, or an immune problem or immune deficiency, they stand a higher risk of dying from influenza than somebody who is virtually very healthy, and they can both contract the same virus. So I'd like you to just speak on that for a little bit, because it does pose a lot of questions in my mind as it relates to the coronavirus, and if any of these factors are being taken into consideration as well.
That comment, that post is a very useful comment. That individual have been exposed to some really decent information. I mean, Beijing, for example, a city with 21 million people, had 8 cases. This is an extremely less than 0.000, and you could go down the line, percentage of persons that are infected with the virus. The post is also correct in the sense that what we have found is that people who die from the coronavirus, I mean, the World Health Organization posts the profile of these persons.
Okay.
They were in the similar profile, over 65, have comorbid conditions, like comorbid meaning that they have other diseases with them, hypertension, diabetes, high cholesterol, cancers, all those sort of things. And so that were very similar to what we've seen. And it is also true that right now influenza is causing more of a problem than coronavirus. Influenza is much more fatal than coronavirus right now. Coronavirus is simply getting all this attention because of the characteristic of it. It's the first time this virus has jumped from animals to human, and that's what it is saying. And so as a physician, let me put it in perspective to you sitting in front of me. If right now, looking at you, you get infected with coronavirus right now, or influenza right now, you're more likely to die from the influenza rather than the coronavirus.
Right.
So, I mean, as a physician, I do not understand why all the noise about coronavirus, but as an individual, as a citizen of the world, I could understand the panic around the coronavirus.
So, let me just add to that, right? There were over, I think it was about 35 deaths coming out of Trinidad as it relates to H1N1. Right? I'm talking about very recently, right? Now, and you touch on a number of key factors. The people who died, they were immunocompromised.
Okay. And just break that down for the listeners who don't understand what immunocompromised means.
So, we're speaking about people who have, like an HIV/AIDS patient, right? Because your immune system is already compromised then.
Right.
So, people who have cancers, them kind of people, so right, the elderly people, right. So that is why we keep telling people that you need to practice proper hand hygiene and so on. No, people are not paying attention, but let me just give you from experience what happened, right. Chickville came down to Grenada, and I could tell you, came down through Carriacou side. It was around Carriacou's carnival.
Wow.
Yeah. Similarly, Zika came through that channel. Now, what people don't understand is that, but you go into Trinidad, where there is H1N1, where you have more people coming to Trinidad Carnival, what are your risks going down there? And I could tell you, because I'm a member of the Regional Health Communications Network, CARFA, which is the principal body for the region, right, and it's based in Trinidad, they have taken the same steps, the very same measures that we have taken. That is what they have done, and that is what they are advising countries to do. So we are not doing anything in isolation. We are not working in a vacuum. We are working in synergy with our trusted, credible partners. I still access, down to this morning, I got mails from my CDC account. So I get information directly from CDC, from CAFA, from PAHO, WHO.
Okay.
So when we make those statements, we are making informed statements, and when we take decisions, we are taking informed decisions.
Yeah, I think over the past few days, you guys have been very clear as to what measures we've been taking. But like I said, it's how you choose to receive information that really matters in all of this. But you brought up a very good point, and it's something that I spoke about yesterday briefly. We have a tendency as a people to go to extremes first. So there are comments that, we should just shut down all flights from China, and that we should not allow anybody to come in from China. And I guess the biggest scare for everybody happened yesterday when we had that private flight with the 8 individuals coming from Beijing. And I think that what a lot of people don't understand, which is what you rightfully said, we don't know where the virus is going to come from if it ever does reach our shores. We don't know, because there are cases in Japan, there are cases in Germany of people who have not even left Japan and Germany that have contracted the virus from just going to work and meeting with a colleague who has come back from one of those places. You know, we have Carnival in Trinidad, which a lot of our Grenadian people attend. We don't know who's coming from where. We don't know what is going to happen. So our best bet at this point is to be cautious.
Yes.
And to follow the precautionary measures.
Yes. That is simply as it is. Just be cautious and follow. You know, I give that example once, and I have to be cautious about how I give that example again. We know that the virus is transmitted through droplets and touch and cough and sneeze. So it is as simple as this. Just stay away from people who are coughing and sneezing and have the cold. Stay further from this. Don't get into the personal space. And that's the way to prevent it. In other words, even if there is someone, worst case scenario, even if there is someone standing in our presence who has coronavirus, standing in the presence of someone who has coronavirus doesn't mean you will get it.
Doesn't mean you'll get it.
Yeah, just protect yourself from the cough.
A fair example, I had the flu.
Right.
I was down 2 weeks with the flu. I have 2 children, they never got the flu.
Right.
You know, because precautionary measures. Lysol everywhere, stay out of my bed, stay out of my room, and I'm wearing gloves, and we're all safe.
Right.
You know, so I think that's a lot of what we have to think about. We don't know. We can take precautionary measures, yes. The government and the Ministry of Health is doing what they deem necessary to protect its people, but we as a people as well need to take our precautionary measures. We have our first caller on the line, so let's quickly take this call. Good morning, caller.
Hi, good morning.
Hi, good morning.
I'd just like to say thank you to the program this morning. It's very informative. It's very reassuring. Concerning the posts that were made to Facebook about banning flights, I would speak for Grenadians when I say that we said that only because of what transpired. Now, let me just break it down just a little bit. The flight that came from Beijing came to Grenada carrying persons. What we're saying is that the minister said, sorry, I'm just kind of hearing myself in the background. The minister said the students are much safer staying put, but you allowed a flight to come in from Beijing. Now, the ignorance of us Grenadians reacting to that, you can't really hold us accountable for that, because we're thinking now about our nationals, our citizens, our brothers, our sons, whoever they may be to us. What we're just saying is, how come some sort of negotiation was not made to have them evacuated if in fact you did, which you did, allow a flight to come from said location? Right? So we're just trying to figure out how come no sort of negotiation wasn't made to have them evacuated, but you allowed a flight of 8 persons to come in the island at such time. That is where the ignorance with us began, because we couldn't process what we were given, what we were feeding, the information being fed to us. We were trying to make sense of it all. And honestly, it still doesn't make sense. that you would allow that to happen, and still our students, our family, our citizens, they're still out there. Now, I understand even they pose a risk to us by just unknowingly contracting something, and we're accepting them back into the island. What we're saying is it's a risk both ways, which somebody should say, okay, we understand your concerns when it comes to the flight coming in. We also sympathize with the families that have their kids out there. There was nothing we could do. All we need is some sort of reassurance. The only reassurance we're getting is not necessarily from the post-cabinet briefing, but from the program that you guys are having, and we appreciate that so much. We're getting much more clarity. We're getting much more understanding, and I just want to applaud you guys for clearing up a lot of the concerns that I would have had. Likewise with everybody, I guess, listening to the program this morning. So I think that more persons should come onto the program and just allow themselves to be filled with such information. Keville, round of applause to you. You're very informative. You're very factual, and this is what we need in order to gain reassurance. So kudos to you and the team this morning. You guys are doing an amazing job.
All right, thank you so much, caller.
Thank you.
All right, yeah, thanks, caller. And the caller's concern are the type of public health concerns that we have around the world as well.
Yeah.
It is important for everyone to recognize that ministries of health in countries respond to guidelines and suggestions from the World Health Organizations and the Pan American Health Organization, including our Caribbean public health agencies. Every disease has certain definitions before the World Health Organization asks you and guides you in certain things. And so far, the World Health Organization is not recommending that countries repatriate or countries evacuate their citizens. Now, some countries have done that. Some airlines have also done that. But because of the current risk and everything surrounding the viruses, it is not recommended that we take anybody away from the area and bring them into the countries. Now, I know Australia, for example, has decided to take its citizen but quarantine them in another place for a while.
2 weeks.
2 weeks. Britain has decided to quarantine them in a military base for
2 weeks,
2 weeks as well. But there is no recommendation that it is not at the level yet where we need to do this, and we're guided by our partners in that response.
I would say I appreciate the caller's comments, and they are making sense, right? At the same time, what I read this morning is quite troubling in that some of the very same people in London who wanted the families come home, now that when they heard that they are going to be quarantined for 2 weeks now, they are somewhat questioning, well, why do you have to actually quarantine them? But it's a necessary evil then, so to speak. Added to that, right, again from experience, and not just primarily what the caller has said, but generally what I'm picking up out there is that people are asking the same question: why did we allow the Chinese to come in? And let me say this: in about sometime between 2009 2010, I was still the communications officer at the Ministry of Health, doing the very same job I am doing now, RISCOM. And I remember we had the H1N1 scare, and the outbreak was in Mexico. We had Grenadian students studying in Mexico, and the population was on our backs to bring them in. We set up now. Mrs. Ann Peters was our Minister for Health at that time. Dr. Emma Harry Thompson was our Chief Medical Officer at that time. Dr. Christine Lagrenade was our Senior Medical Officer at that time. Miss Rosie Bowler was our Chief Senior Health Promotions Officer at that time. So a lot of people who are there now are still around. They could actually say whether I am being honest or if I am not. And let me tell you what happened. Right? Now, a couple people came in. We had to make arrangements down at SGU Grandans campus on the beach. There was this building closer towards the seaside that was used for quarantine. The ministry took a lot of blows for that. Let me give you some factual details here of something else that happened. Now people saying, why should we allow them to come in? Now, during the height of the H1N1 outbreak, 2 cruise ships came to Grenada. They were allowed to dock, but not disembark.
Right.
The ministry, a delegation of tour operators, are talking about taxi and all, even people who was operating the water taxis and so forth, they were up in arms against the stance taken by the Ministry of Health, citing that it had caused them to lose much needed revenue. Now I asked the question, because the virus is now, in about 16 other countries or so, right? The question is, we have cruise passengers who will go to certain ports. So for example, if I am going on a cruise, depending on where I'm going, I will have to travel maybe to Miami to get onto that vessel. If we have 5 vessels right now in Grenada with over 30,000 people or so about to come off onto our shores, will the public back us in saying, because we are not sure, you should stay on board and cause us to lose revenue? It's only a question, and it's a hypothetical question, because I have the experience of what transpired during that period. We were cursed. We were insulted by the very same people who are making noise now, because you see, what they will say is that they lost $1.
Yeah.
The hotel people will tell you they had catered so much. The roadside vendors, the taxi operators. So that's why I'm saying, what we do it in a systematic fashion, and we would have learned from our experiences. Hence the reason why we are doing what we know is best to do and what we have been guided to do. So it's a give and take balancing point.
Before you continue, we have a caller that's been waiting on the line. Good morning, caller.
Good morning.
Hi, good morning.
Gentlemen, good morning to Ms. Duncan.
Good morning.
Morning.
Morning, ma'am.
Funny how Keville just kind of enforced what I was going to say, the comment I was going to say. The Bible said, for the lack of knowledge, the people perish. And, I'm speaking maybe on behalf of the Chinese this morning. And I wonder if we're going back to the days of Bible, leprosy, where we have to ring a bell if we have the disease. And it seems so, because a lot of us is so ignorant, we're so insensitive of other people's feelings. I had a customer 2 days ago, and she came with a mask, and she's saying, people, the Grenadians are telling us so much insulting things, and we have to be mindful that they are people too. We don't know where the virus came from or the disease, and they are people, and they did a lot for Grenada. So no, I would really like for someone to appeal to the public at large to be mindful of what they are saying to these people. It is very insulting, and we need to stop it. Thank you.
Thank you. And there is no scientific reason for the decisions these things that they were saying. There is no scientific reason. I want to point out a major difference between bringing students home from Wuhan and the flight that came. The flight that came, it was a low-risk flight. We tested them and so on. And these are Chinese nationals who is going to leave in a couple of days. Yeah. The incubation period of that thing is a while.
Days, yeah.
If you bring students home, these are people who are coming home. If they're exposed to the virus, they come here and they're staying here.
Yeah.
That is a major difference.
Major risk.
And a major risk. So in the sphere of public health and the practice of public health, those are the kind of things we take on board when we make decisions.
Absolutely. And from what the caller is saying, because that is not the first time that I've actually heard something like that. And I believe she's speaking about a Chinese national, somebody of Chinese origin. And there was a story that I've heard just the other day of a lady having to walk around with a mask. She hasn't even been to China in however long. She came from New York City, and she feels like she has to, because of the abuse verbally that she is receiving just for being a Chinese national. She hasn't been to China. She has been nowhere around the virus. She's been in Grenada, by the way, for a while now. But just the fact that she is a Chinese national puts, her in a position to be abused, and that should not be that way.
Right.
It's unfair to these people, for us as Grenadians, to behave in that kind of way. I mean, yes, we are concerned. Yes, we have a right to be concerned, but we also have a right to be considerate. And we also have to take these people's feelings into consideration. Because as I said earlier, we do not know where this thing is going to come from. The UK has a case. Are we going to say now let's ban all flights from the UK?
Exactly.
And the
Are we
States?
going to say to all the people who would have already purchased their tickets for Trinidad Carnival, y'all can't go because y'all are at risk to be exposed to the virus?
You see, and these are decisions we can take.
Exactly.
If we do that, listen for the backlash.
Yeah.
So we ought to be reasonable.
Sometimes we love what we hate as Grenadians. We love what we hate. But I think it's important for us to really sit back and just take a breath. Take a breath and make decisions. So there are a lot of measures that, a lot of pictures going around of measures to be taken. One of them includes taking vitamin C and vitamin D to improve your immune health and so on. Are those things that the Ministry of Health recommends to its people?
Absolutely. In all of my public statements and when I do my lectures and so on, even we met with the Ministry of Health staff a few days yesterday. And my final parting words to them was tips on how to improve their immune system. And so I'll do the same thing here. First of all, you make sure that you have sufficient sleep. Don't stay up too much at night. Drink a lot of water. But really important is to eat bright colored foods. Any food with colors in it. So your pink, yellow, green, orange. So we're talking about your pawpaw and that sort of thing. Those are the foods that actually boost one's immune system. And so this is what I really recommend at this point in time. And avoid the fast foods and avoid whatever, we know what they are. Those are the really important things that we want to tell people that they must and try and use at this point in time. Don't stress yourself too much, because I find a lot of the times when I go out and talk to people, we always like to blame something else for a problem. When there was Chick-fil-A, no one wanted to take responsibility to clean up their own backyard. They would say, they even went as far as to say it was not spread by mosquito just because they did not want to clean their own places. So when there is Zika, we blame something else. Now we can simply protect ourselves by practicing good cough etiquette and hand hygiene. And we still don't want to do this. We still want to blame somebody else. We're saying, in order to protect ourselves, stop people from coming in. That doesn't make any sense. As people, we have to start taking responsibilities for our health. And if you do this well enough, not only would you prevent coronavirus, you're also going to prevent influenza and other types of viral illnesses.
Okay, I think it's important, as a mother now speaking, I think it's important for our children to be educated, not just at home, but also in schools, because I may be able to educate my daughter and my son about proper cough hygiene and all of that, but there are people who aren't able to do that. Is the Ministry of Health putting plans in place to ensure that this message goes out to the schools? Because children listen to their teachers. There is nothing that I could tell my son and daughter that trumps what their teacher tells them.
Absolutely.
So is there a plan in place for this to happen?
Glad you asked that, because Keville, yesterday, we made a decision to put the plans out. Not that we weren't sending information out before anyway. We were sending out information, but sometimes we think that, just this one-on-one personal touch is important. So Keville, I think, has drafted up a plan for us to go through this, and I'm guided by his plans.
So, and Ms. Duncan, it is important for me to say here that we have a very active, well-organized school health program. So long before coronavirus, you would see our nurses, our health promotion officers. Just last week or so, Ms. Ray Goddard visited the Western District. That's her district. So we have a good interaction with the school network. That is flawless. I could tell you that. So what we decided was to capitalize on that and let the same officers who are in their respective districts do the information sharing at that level.
Okay.
So to answer the question is yes. And likewise, what we are going to be doing, so for instance, tomorrow we are going to be meeting with some of the other ministries. We are doing inter-ministerial meetings in that the same information we are giving here. So we did that yesterday with the staff from the Ministry of Health. We will be doing finance, education, immigration, tourism, all of the ministries and agencies likewise. So don't be surprised if we say that we are going Grenada, because it happened before. We did airports some time back. So we are always out there meeting with those organizations. And like I said, people will think that we're not doing, but public health is, from my experience and training, there are certain things that, as Dr. Martin would say, you just don't go on stage and start being a flag woman about.
Right.
No, because you see, sometimes it's so personal, right?
Yeah.
I mean, we have helped people walking into the ministry who are at the breaking point of committing suicide. But
Wow.
and I have helped someone. I said, do not make that person sign the security book, because you have to tell them what you're going for.
Yeah.
So sometimes we have to do those things undercover, meaning that, so bring you inside and chat with you. I have seen people bottle lunch and even give clothing and so on to people who are nearly at that point of losing it, and we had to take them in our personal vehicle, go out with them, chat with them, and bring them back home. They walk around now good, and they will say, hadn't you done that, I would have been a dead person. So not every time that we have to come out there and say that we're doing that, because I'm telling you, it's very, very, very personal.
Yeah. I think that social media, well, not think, but social media plays a big part in media these days, in sharing and receiving information. Has the Ministry of Health put together a plan, if not already implemented a plan, to really flood social media with information? Because what we find a lot is that Grenadians hate to share good things that are beneficial to us. We don't like to share it. But I think if we share it enough, at some point we'll get into the groove. It'll become a routine for us to really share the important factors. Like, for example, I recently received a couple health tips and tips on how to prevent the coronavirus, and safety tips and these things, and I've been sharing it. But I went on social media to see how many of my friends shared it as well.
And how many was that?
Not a lot. Not a lot.
So
so it goes to show.
So you see, I shared the program on our Ministry of Health page since we started.
Right.
And we have information package likewise for the airports. And I am happy to that you raise the point about social media. And I'm making a clarion call, and I'm very sincere about it. I'm asking my Grenadian brothers and sisters, regardless to whatever you think, be careful about certain stuff on social media. Now, I saw a story that came from the Ministry of Health in England. And it's just simple tips. Now, maybe because I had the training in identifying those things, it makes it easier for me. But I am appealing to persons to pay particular attention. England, you will never find something like the Ministry of Health England. You will find Public Health England or Public Health London.
Right.
Similarly, you will find Public Health Canada or Public Health Ontario. There isn't a Ministry of Health in Australia. It is not called by that name.
Right.
So if you're going to share information, make sure the source is credible.
Yes.
By looking at those, even logos, because there are plenty fake people out there, right, who will just do something and make you run go with it, thinking that it is bona fide.
Yep.
And we have, at the regional level, we know of instances whereby people took information on social media, they went with it, and they lost their lives. That information came up at our closed door meetings. No, I wouldn't tell you which country and so forth, but I could just tell you that it has happened. I'm sure Dr. Martin is aware of that.
Yeah.
So respectfully, trust the Ministry of Health. We are the credible source.
Right.
And I could tell you, be very, very stringent, be very, very cautious in looking at those bits of information, because people will fake those people are even copying logos and put it on to different things and sharing it, and that is wrong.
And it's not hard to do.
It is not hard to do.
It's not hard
but
to
it
do.
is dangerous. So we ought to be extremely careful.
Right. So, of course, this is and a perfect example is yesterday morning. Everybody is talking about 250 Chinese coming on the airport. You know, it was all over social media. Everybody got frantic. Everybody was, running all over the place talking about, how could they allow 200 and... First of all, let's think about which flight is going to carry 250 people into any country, much less Grenada. And sometimes we have to think about things logically even before sharing it. You read something, sometimes we just read something and we forward to everybody, forward to a group, forward to a chat. We just forward it. We don't read, and we are sometimes part of the problem,
Yeah.
We are sometimes part of the problem. So, guys, the lines are open if you have any questions. The number to call is 440-7377 for local calls. If you have a WhatsApp message that you'd like to send us, it's 440-7377. Also, remember, we cannot take WhatsApp calls, but we can take your messages. And 347-329-3101 if you are in the diaspora and you would like to ask us a question, as well as posting on our live page. We are ready to answer any question that you may have, any concern. What I do want to make a statement on would be our students in China. I know that we have a bit of them over there. And with the lockdown of Wuhan, those that are there, it's not possible for them to leave.
I suppose that would depend on the government, on the administration of the city, but yes, they would not be able to leave because of the lockdown.
Okay, and then there is a risk of them, of course, coming back, because not only do they have to come to Grenada, they have to take a commercial flight
Right.
to the UK, and then another commercial flight to Grenada. So apart from just the risk of them having the virus and it being spread in Grenada, we have the risk of them sharing it with passengers on other flights. And I mean, that it would never be a good label for Grenada to know that we were part of the process in sharing the virus with others. And I think that, of course, the Ministry of Health, along with Foreign Affairs, and you can confirm that if or deny, would be in contact with them to ensure that they are of good health and share with them, of course, the embassy to share with them what tips they need to take in order to stay safe.
Yeah, I mean, I was told that contact was made with them. I cannot give you details of the contact. I was pretty sure. But the good news about this whole situation is a healthy, normal student of the age that I think that they are at, even if they contract coronavirus, they are hardly likely to die from it. And that's because the deaths has been in the above 65 age range and people who have other type of diseases with them. So a healthy young adults, over 90% of the people who contracted the virus recover with no complications whatsoever.
And that's what I wanted to ask, because we have 3,000. A lot of people are saying, the incubation period is 14 days, which means it's 14 days that the before the virus can really show itself.
Right.
How many days exactly would you say that the virus would take to run its course?
Generally, these viruses run their course between 3 to 5 days in mild cases, or 5 to 7 days in mild cases, and 7 to 10 days in severe cases. In a healthy young adult, it may even last shorter, because based on the available science we have right now, a healthy young adult will go through the coronavirus similar to what we do with the common cold.
Okay, let me just answer Junior George. Junior George, no, we are not saying that any student has contracted the virus. We are speaking about the possibilities of the students that we have there in China coming back to Grenada, and what risk it can cause in the event that one of these students have the virus. So no student, let me just make that clear, because people just don't like to listen and they just take information half-baked and run with it. But no, none of our students have contracted the virus. As far as we know, all of our students have been in contact with the ambassador, and they are all safe as it stands right now.
Yes, as it stands right now.
We
with
could
no
also
reports.
say that all options are on the table, but of course, we have to carefully analyze what we're doing, because you raise a very, very important point, right? Now, assuming that we are bringing back our Grenadian students and they are transiting, do we know who are the other people coming into that same terminal who are transiting? So even if they get out of Wuhan or China safely, assuming that,
Yes.
you have to say spend 4 to 8 hours in Heathrow in transit. Can we safely sit in Grenada here and say who are the other people? Because I listened to something where somebody said that they have an African roommate. Assuming, right, that African roommate, because okay, as far as we know, we're looking at Chinese.
Right.
So what if that African roommate goes to another country and then still end up coming back to Heathrow and mingling and mixing? Do we know?
Yeah.
So, I mean, I said that because at our meeting yesterday, we had an emergency meeting that's with CAFA yesterday, and Dr. Joyce St. John, who was one of the director generals at WHO, PAO, she indicated that these are some of the things that us as public health specialists need to really carefully consider before we make certain decisions, because and then again, only the CDC in Atlanta and the public health Canada lab that can really test for the virus at this time while we are sitting here. So they can't even test in London as yet.
Right.
Wow.
Yeah.
Wow. And that is basically a hub to get to. But what I'm really getting to is that, so we have a 14-day incubation period, a 3 to 5 day period where it runs its course, right? Now, we have 4,500 people that have been infected. And this is the kind of critical thinking that I'm hoping that a lot of people start doing. We have 4,500 people infected worldwide. We only have up to 130 deaths. So that really does say a lot. And it's per capita.
And it's per capita, so you can imagine.
So it says a lot. And I think sometimes social media, along with general worldwide media, sensationalizes things a lot. It's not me saying that we don't have to be cautious. It's me saying that, yes, it's an issue. Yes, it's something new. Yes, it's something that we're watching, that the world is watching. But would it be so bad if there was a cure, or would it be so bad if it was something that we've seen before? Would there be such a big buzz about
absolutely
the issue?
not. No. I mean, from a public health standpoint, I'm just putting away my public health cap right now. Mm-hmm. If coronavirus was there before, this particular strain, this experience now, we would not be having it. No one is going to speak about it, because dengue is in the region. Dengue is causing far more lethal problems for us right now. Influenza is causing a lot more problems for us right now. And it worries me as a public health practitioner that we have moved our attention away from something that is more likely to kill and something that is currently killing as we speak. There are people dying from this, and everybody's just focusing on corona.
Well, from my research, I've been doing my research, and people have been talking about the influenza, only to know that there have been 89 or so deaths from the people contracting influenza just in Trinidad alone.
Absolutely, yes, there you go.
just in Trinidad alone. So this is not me saying that we don't have to be concerned. We have all right to be concerned, because it is something that is alarming. But we also need to be concerned about a lot of other things. So are we going to say, well, we're not going to practice good health hygiene because influenza is not as bad as the corona? How do we even know that?
No, we don't.
How do we even know that?
According to the current science, is the other way around.
It's the other way around.
Yeah.
So it's just basically, at this point, we just need to be cautious.
Yep.
Practice good health practices of washing our hands, using our hand sanitizers, of course, as you said, building our immune system with a colored fruits and vegetables. Well, that kind of plays into what we've been talking about all week.
Always, yes.
Go to the market and buy local. Go to the market and buy local, because we pass there every Friday and every Saturday, and we see an array of colorful fruits and vegetables, and we pass it straight and go in the supermarket, or we go in KFC,
Oh, man.
or we go in in Subway. But I think that it further, puts pressure on the point that we need to start eating what we grow,
That's right, yeah.
and growing what we eat. It not just helps with our economy, but it helps with our health as well.
Absolutely.
Keeps us healthy. So, guys, well, I guess the program was so good nobody needed to call and say anything. Nobody needed to call and say anything, but we will leave the line open for a few more minutes in the event that you have a burning question that you want to ask. But for the listening public, our students are safe. And of course, as Dr. Martin and Mr. Frederick was saying, trust your Ministry of Health. Do you guys have a Facebook page?
Yes, we do.
People can go onto the Facebook page, and these are the kind of pages y'all need to subscribe to. Subscribe to your local pages. Know what's going on.
I mean, and I was telling my family, I said, listen, we have information that the public doesn't have, because when PAHO don't call an emergency meeting or an online meeting with John Public.
Yeah.
They don't even call that meeting with Ministry of Education. It's the Ministry of Health. As we speak, Dr. Tedros and so on, they are on the ground in China trying to ascertain what happens. So we cannot tell you everything at this stage, but once the information comes to hand, we will tell you. Yesterday, when we had the meeting, I said that PS and Minister as well as Dr. Charles was in a meeting online, and once they are finished, we would be updated. And that happened. Dr. Charles came because we were reporting some figures, and then it had just changed. So Dr. Charles came and he gave the updated figures. So it's work in progress, and that's one of the principles of RISCOM, is that we have to be consistent, right? Because the information will change. The way it transmits will change.
Of course.
So, I mean, we have to be on top of it, and we are on top of it. But likewise, if the public does not trust what we're doing, it makes our work more difficult.
Of course. And with information changing, it means that at some point, something that was said earlier will contradict something that was said later. And I think it really is, as you said, about trust. We need to trust our health officials, that they know what they're doing and that they're doing their job.
Let me give you one quick example. When and we were told that by the WHO RISCOM manager, Dr. Kamahaya. Now she is the person who wrote this book, right? So you see what the mark?
Participant
right.
handbook.
Now, they had gotten it wrong, right? When they first dealing with the Ebola, and I'll tell you how. Now, a lot of the Muslim countries, when you're about to be buried, you are clad in white. Now, in our part of the world, it's what? It's black. Because black is a symbol of mourning down here. If you go just in Trinidad, when the Muslims are mourning, the Hindus and so on, when they are burying people, and everybody is dressed in white.
In white.
Now, so they had used the different color bags.
Right.
Now, in one particular city, the virus spread very quick. You know why? Because the bags that were traditionally used were white. So the children thought that it was okay to mingle with their loved ones. And that's a fact. But you see, Grenadians don't do those kind of in-depth research. And it's basic, it's common understanding. So when they realized that was what was taking place on the ground, they had to go back and recall all those white bags and started using black. Because in that particular place, they know white is a symbol of life and the afterlife, and so people were so these little things, I'm sure many people never knew that.
I didn't even know that.
Exactly. So this little thing, we are aware of it, so that's why we keep saying trust what we tell you. Because John Public would not get that information, but Power would share that with us. WHO would share that with us.
Right.
So that's just food for thought.
Right. Well, I see my mother is here on this live video advertising that she has lemons. Mommy, if you give away all the lemons, what am I going to, how am I going to get my vitamin C? But these things are important. We have so many things that we can use here locally. Like you said, our yellows and our orange and pink and greens that we can use to really help build our immune system. Those people accustomed to taking their vitamin C every morning before I leave home, I take my vitamin C, my vitamin D, and my vitamin B12 every morning consistently before I leave my house. Good. So I know that it's important, and of course it's a routine. My children, when I don't remember, they remember for me because they do it as well. And I think that's something that we need to start doing. I know we bash the healthcare system a lot, and maybe it could be more than it is right now, but we need to do a lot more ourselves to keep ourselves healthy so that we don't have a reason to bash the healthcare system.
Right.
If I'm healthy, I don't need to go to the hospital, so I don't know that, that there's a shortage of this or there's a shortage of that. Hypothetically speaking, people, I'm not saying that there is, but I need to say that because some people just take what you say and go with it. But if we keep ourselves healthy and if we do what we're supposed to do, then a lot of the problems, a lot of the strains that we put on the healthcare system can be avoided, and then we can spend more time building the healthcare system as opposed to dealing with the strains that we ourselves that complain put on it.
Absolutely.
So that's very, very important. But I mean, there isn't really much left to say unless you guys have any closing remarks, because the people, I guess, they're so happy with the information that they're getting that nobody is flooding the lines today. But do you guys have any closing remarks?
Just to reassure the public that the virus, while it is new to us in public health and the world of virology and science, while it is new to us, the novelty of it is what we like, because then again, the research is going to start now continuing as to how to deal with this virus, and I think we're going to get to the bottom of it. But the good news is that the virus and the clinical behavior of the virus is not as bad as people are thinking, and that normal, healthy people will be able to get over it. More than 95% of the people who get sick recover without any complication, and you can protect yourself by avoiding personal space and by ensuring you have good cough etiquette and hand hygiene. Wash with soap and water. Use the alcohol-based hand sanitizers as much as you can. And once you do so, with the clinical behavior of the virus, I believe that, God forbid, if a case or so come in our region, that we will be able to manage it as a public health concern.
Okay. And before I move to Mr. Frederick, I want you to just repeat that statistics again so people understand. Not everybody that contracted coronavirus has died as a result of it.
Absolutely not. More than 95% of people who get the virus live and they recover without any complications whatsoever. It is the 0.000 something percent that actually dies, and those are people who have other disease conditions and the immune system wasn't able to stand up to the virus.
Wonderful. Any closing remarks?
I would just like to encourage my Grenadian brothers and sisters out there, to trust what we are telling you. We have the training, we have the expertise. We have done it before, and we can do it again. And just give us the support that we need, and listen to what we are telling you. And we always say at the Ministry of Health that your health is your responsibility, but it is our priority. So wash your hands as often as possible. When you're handling money, before and after using the bathroom, eating, all of those things, touching different surfaces, and please, people, spirits work if you don't have hand sanitizers. Clock Scott will work if you don't have it. No, seriously. So alcohol will work, right? But wash your hands. Cough in your elbows. Use a tissue. Dispose of it properly. Make sure it is fully inside of the bin. Wash your hands. We cannot overemphasize the importance of hand washing. People go out there and shake hands. I am not saying do not shake hands. What I'm saying is, remember, before you touch your face, before you touch your nose, your mouth, your eyes and eat and handle food and so forth, it is the proper thing to do. Wash your hands.
Okay. I have a question though. I wonder if you're the right person to ask that question, but I'll ask it anyway. Is the Ministry of Health, we understand the situation in Grenada, where there are a lot of our children, a lot of our families, who really do not have the means by which they can access hand sanitizers and all of these things. Would the Ministry of Health be able to help in that department?
Hand sanitizer is not an absolute necessity. It is just a convenience for persons who have to manage lots of people, like tellers, people at immigration. But under normal circumstances, if you are a person who is not, your job doesn't require you to mingle and contact multiple persons during the course of the day, there is really no reason for hand sanitizer.
Okay, just wash your hands.
That's
wash
it. Just be clean.
And would you recommend, as a physician, would you recommend that persons use those disposable towelettes as opposed to a rag or something like that?
Yes, I even in my own house, I use disposable paper and cloth because reusing one thing can actually, the term we use is called fomite. That is, someone places a virus on that, and then they leave and you go and you touch the same thing and you get the virus, and that's possible. So just be prepared.
And of course, this would also help us to appeal to bus drivers and owners to wipe down your vehicles.
Yes.
Wipe down a little bleach and water and wipe down. Help in the process.
Even if a bus driver has a bottle of hand sanitizer that he can pass to his customers, his business is going to flourish.
Right.
Because people will see that, okay, you know what, he is looking at not only his well-being, but he is looking at my well-being likewise. I remember when buses started putting free Wi-Fi on buses, what happens? The ones that didn't have Wi-Fi, nobody going on them. So seriously, bus drivers should actually consider that. And it is going to work. It is going to be a plus for them and for their business, and a plus for us, because it means that they are also carrying our message to their clients.
Okay. And the last question, I promise, Mr. Frederick, I guess, would be able to answer this. Grenadians are a visual people. Is there any way that I've seen other international countries have done it, where they show the process, the screening process, where you can see how the thermal cameras work and so on. So people who still don't even understand what we just said have an idea of what it looks like.
The answer to the question is yes. We have so the storyboard for that is being created, and I think it's very timely because I forget to mention that even our frontline workers, they have been educated and they have been looked after. So now you will see at some point in time our immigration officers using gloves. Right? Now, what will happen is that when they handle your passport, before taking Nazim's passport, they would sanitize the glove. That way, if there were anything on your passport, they would not pass it on to Nazim.
Right.
So I'm just letting people know, because that may be a question somebody might ask you later. So I am telling them now, those protocols are already in place. There are protocols likewise for our ports of entries, not just the airport. I'm speaking about the yachting, because we are a yachting destination, right? And funny, everybody talk about Chinese coming in on plane. We have yachts.
Yes.
So that's what I'm saying.
Yeah.
We need to broaden our horizons in dealing with things like that, and not just get too emotional. I would support people. You need to be concerned. You have a right, and do not think that because we are telling you what we are telling you, that you do not have a right to be concerned. Share your concerns with us, because it's because of your concerns it will empower us to do more and to address your concerns and help you in allaying all fears. So yes, that is being done, and so we hoping to actually have it out maybe by about Friday or so. But we are running here because we get calls, right? Calls for information, calls for for interviews and so forth. But we are doing what we can, and that video will be out shortly.
Oh, and there was a concern about Carriacou and PG Matic, and of course it would be bad of me not to ask, because as you mentioned, we in order for a case from China to get to Grenada, to get to Carriacou, they have to come through Grenada first, so they'll be checked in. But we're talking about yachts, as you mentioned. We do have people on yachts going to Carriacou and so on. What procedures are the same procedures being used in Carriacou and PG Matic as well?
You have ship declarations and so forth. So the ship declaration is more of a kind of detailed kind of a thing. So it's still not the cruise industry, they have what we would call a more rigorous system.
Right.
Yeah. Plenty checks and balances. And that's why I said when the ministry took and unfortunately it was a good decision we took back in around 2009 thereabout, because when that ship went Barbados, everyone on board was infected.
Wow.
So it says here, you may not understand why we are doing what we are doing, but we are doing it for your benefit.
Absolutely. Absolutely. Well, it really has been a pleasure speaking with you guys. I think it has been, and not just me, but the callers and the comments, a very informative session. I have learned a lot, and I'm sure that everybody else has learned a lot as a result of this. I'm hoping that the message reaches as many people as possible so that we all get a better understanding. And just the same way that you've been sharing that 250 passengers come from China, or that the government of Grenada not doing anything for the Chinese students, in that same way, we are asking you to share this program so that other people have an idea as to what is happening.
That's right.
And so other people are educated. I have it via WhatsApp. I have shared it with all my contacts. When it comes to your phone, don't keep it to yourself. Share it with everybody else. This is not me asking for you to share it so I can get coverage, or asking for you to share it so our ratings go up. No, this is an appeal for you to share it so that everybody can be educated on what is happening, because we all need to be educated. So thank you so much, guys. Yes. I see my technician laughing hell hard in the back there. Hell hard. If you see what he's laughing at. But it's a pleasure having you guys. It's really been an informative session. We're going to take a short break, and then we will be back with some more information for you as it relates to the recent events. Thank you so much for listening.
Thank you again.